we're joined now by Jersey's Health Minister, Deputy Richard Renniff. Deputy, thank you very much for coming in. So you heard there just a few people in the front line saying there's problems with buildings, waiting lists, a shortfall in services. This is all due to a lack of investment, isn't it?
It's due partly to that and partly to the difficulty in recruiting sufficient staff to provide those services and take the service forward.
But of course that's all tied up with cash as well, isn't it? Not having the cash available.
The cash has been available to pay for the staff. It's recruiting the staff that has been the difficulty in the past. But we are beginning to turn that corner, and I'm getting reports that we are making good progress on staff recruitment.
Let's look at the money, because ahead of Mental Health Awareness Week, ITV Channel Television has put in a Freedom of Information request to look at how money is spent on mental health care in Jersey. It showed a significant amount of cash allocated in the budget has gone unspent. And last year, for example, more than a third of the budget went unspent. Since 2016, in total, £350,000 has gone unspent. That's money set aside specifically for mental health care in Jersey. I think many of our viewers would find that staggering.
But that Freedom of Information request was specifically around the spend on mental health social workers. And as you say, because of the recruitment difficulties, we were not able to employ as many social workers. So there was that underspend, £350,000 over 3 years, in mental health social workers. But last year, our budget and our spend for mental health was more than £21 million.
Are you really saying that there's no answer to the recruitment problem? I mean, surely there must be some kind of answer. You've been in your position now for a year. There must be some answer of being able to recruit the right people for this care that people so urgently need in Jersey.
It's a constant challenge, but there is an answer, which is just to keep on applying diligence, and I am seeing now that by different ways of doing things, so our job vacancies are now advertised on the NHS website, which they were not before. We are making personal contact with people who get in touch with us and inviting them to Jersey and talking from the very beginning of their interest about the challenge in Jersey and how it could mean for them professionally. And that is beginning to turn into interest, which is beginning to turn into job interviews. And we are in a position now where we are offering those posts to people who are interested. And I'm just waiting to see what the take-up is of that.
When it comes to the underspend, what's been done with that money? Because that is a significant amount of money that surely could make quite a big difference if spent in the right way.
Well, we will be spending, if my colleagues in the States Assembly support the government plan we're putting together, we want to put significant resource into the estates, the new buildings, to re-provide Orchard House in a different place.
Well, let's talk about Orchard House, because on Tuesday's programme we heard from one family who have got serious concerns about Jersey's acute mental health facility, Orchard House. Now, I think everyone agrees it's not up to scratch. I know you are planning to move into a new building next year, but what's been done to improve that care now?
We've done what we can to improve it in the building it is, but it's a poor building. It's not a good therapeutic environment, but there are improvements being made just to try and make life that bit more attractive there for the people we asked to stay there.
OK, just finally, Deputy, if I can ask for a brief answer on this. The number of suicides in Jersey are significantly higher than in the UK. In 2016, they were double. Does that indicate there is a serious problem with acute mental health care in Jersey?
I don't want to worry people about this, but taking just 1 year's figures for a small place like Jersey, with figures that are smallish in the scheme of things, is very problematical.
But the trend does show that it's much higher than in the UK.
I don't agree there's a trend. I think we're not too different from the UK, and it's better to take figures over a period of time rather than to concentrate on 1 year's figures, because they do fluctuate. So the statistics do show in the mortality report most recently issued that.
So you're saying there's not a problem? You were saying there's not a problem?
There's always a problem. Nobody wants to see people taking their own life. That's always a tragedy. But it's not right to say that we have a greater problem than, say, in the UK. And our therapists and people who are working in mental health are dedicated professional people who are always trying to avoid that outcome.
OK, well, we'll have to leave it there. Deputy Richard Renniff, many thanks for coming in.
Thank you.